to BNC Live. I'm Tishani Whitlow. The DEA has issued a warning about the uptick of fake prescription pills laced with fentanyl. For the first time in 6 years, the Drug Enforcement Administration has issued an alert about laced drugs. Some of the 9.5 million counterfeit pills seized this year alone could contain lethal doses of fentanyl. The pills, they look just like opioid medications. They're sold on the black market, though, and through social media, which is the biggest concern. People who buy black market opioids could die from an overdose of fentanyl and not even know what they were taking. Now, joining us now to discuss more on this, she is an assistant professor in the Department of Psychiatry at Yale University of Medicine, Dr. Ayana Jordan. It is a pleasure to have you on, Dr. Jordan. For the DEA to issue this type of warning, can you just talk about how serious this is and how concerning it is that these fake pills are popping up on the black market, which kids have access to?
Yeah, thank you so much for having me. And like you said, it is a very serious issue, but I think it's important to know that this has been a serious issue. This is nothing new. We've been dealing with this for the last 5 to 7 years. And what we're seeing now is definitely an increase in the availability of fentanyl in terms of it contaminating the substance use sources. But the reality is that unfortunately, is a failure of drug policy in this country, where we're at a position now where we're having fentanyl in the supply and people are not able to access safe supply. So yes, it's getting worse, but this is something that could have been circumvented, and it will continue to get worse if we are not serious in terms of changing drug policy.
Do you think this is an issue about pain management?
Definitely pain management comes into play when we're thinking about why are people accessing more prescription medication? Why are people needing to uh, get illicit opioids and pills? But I think more importantly, in terms of not treating pain adequately, is thinking through what is happening in this country where people are not able to get adequate access to healthcare, where they are able to engage with physicians and engage with providers, where they can get prescription medicine and they don't have to go to the street. So people are only going to illicit markets or black markets because either regular health care is not accessible to them. It might be out of reach because they don't have access to health insurance, or maybe they can't afford the copays. So when we're thinking about what is the policy in this country that makes it so difficult for people to get access to the help they need? And I think we've seen with COVID-19, we're not even thinking about just physical pain, right? Of course, but also psychological pain. People are really suffering mentally, psychologically, because of the isolation, because of the loss of loved ones. And so we want to make it easy for people to get the access they need so they don't have to go to buy fake prescription drugs on the black market.
And the CDC recently reported 93,000 drug overdose deaths in 2020. They also reported a sharp increase in overdoses among our people. Why are our people dying at such an alarming rate? We just saw Michael K. Williams accidentally overdose.
Yeah, that was really, really tragic, and just so terrible. And when I saw that news, I actually cried, as an addiction specialist that particularly takes care of Black people with substance use disorders. And I just want to be clear, it's nothing that Black people are doing specifically that puts us at higher risk of dying from fentanyl, which is a man-made opioid that has been contaminating the supply. So wanting to make it clear that there's nothing about Black people particularly that is putting us at risk, but rather it's the system, right? The system that differentially advantages white people, where they're able to get access to treatment, where they're more likely to get the medicine to treat an opioid use disorder, and Black people are not given that same equity and access to care. So when we're thinking about why is it Black people, why are we seeing Black deaths out pace those of white deaths, it really is a system. So racism, not race, that is causing these disproportionate rates. And if we're serious about not continuing to lose people, we've lost, Prince, we've lost Michael K. Williams, we've lost DMX, we've lost some real heroes in our community. We have to think about safe supply. How can we make sure that people have access to safer drugs, are able to test if they're using something illicitly so they're not dying, or also making sure that they're getting the help that they need and not being sent to the carceral system, where we know people who are Black are more likely to be sent to prisons and jails and not medical treatment for their opioid use disorder. So these are the structural problems that have to be dealt with. And I appreciate the DEA saying, one pill kills, but that's not the message that we need to get out there, because what are we talking about? Not one pill is not always necessarily going to kill, right? What if we're thinking about access to safe supply? Then you'll be okay. So the message really is, if you need help, it's okay to get help for opioid use disorder. There are ways to keep yourself safe. One of the things that I do when I'm seeing patients, I give them access to what's called fentanyl strips. So that way they can actually test what they're using, because people don't want to die. These are unintentional drug overdoses, right? So if they're able to test what they're using and they see that it's positive for fentanyl, then they will not use it. And then they can tell other people, this is not a safe supply. And systems like this are regulated in other countries with really good results. We see this in Portugal, where they actually have drug testing sites where people are freely able to test their substances, so that if there's a presence of fentanyl, they know it's not safe. So these are the things we need to do. And also we have to have, especially for Black people, make it easy to get treatment, right? It can't be so hard to get treatment, because if it's easier to get the dope or the opioids or the pills from the street or the internet than it is to get treatment, of course we're going to continue to see the rise in overdose deaths.
Yeah, all great points. Can you just shout out some websites for any of our viewers who may have family members who are suffering from addiction and they want to supply them with the help, or maybe the person themselves suffering from that addiction?
Yeah. So one of the things that I always say is go to SAMHSA's website. That is the Substance Abuse and Mental Health Services Administration, samhsa.gov. G-O-V, or you can call 1-800-662-HELP, 1-800-662-4357. I wanted to make sure that I got the numbers for you all. That way you can go and you can say, where can I find substance use treatment closest to me? You can always call if you're not computer literate, just wanting to make people aware that a lot of Black people don't have access to the internet at home. So you can pick up the phone and call 1-800-662-HELP. I'm so glad you guys are covering this. Such an important story. Drug use, overdose deaths are preventable. It's not something that we can't get out of.
Yeah, absolutely. Dr. Jordan, thank you so much for joining us. More importantly, thank you. And we'll be right back. You're watching BNC Live.
Closed captioning brought to you by Nutrisystem. Lose weight and get healthy.